Hello, welcome to Pathfinders for Autism Zoomcast. I'm your host, Rob Long, and this week we're joined by Penelope Kaikis. She is the speech-language pathologist at Kennedy Krieger Institute. First of all, hello, Penelope.
Hello, thanks for having me.
Thank you for your time. Thank you. I know you're a very busy woman. First of all, tell us what are speech pathologists and what exactly do they do?
That's a good place to start. So speech-language pathologists, also known as SLPs, they evaluate, diagnose, and treat a diverse population of individuals, from infancy all the way to adulthood. They present various communication and swallowing disorders. So these disorders usually are presented in individuals with autism spectrum disorder, intellectual disability, developmental disorders, and various syndromes, and so on. We really work with a broad range of individuals with a large population. We also work in a variety of settings. So you can find us working in hospitals, schools, colleges and universities, rehab centers, residential healthcare facilities, and so forth. So the overall goal of a speech-language pathologist is to really help the person communicate in a more useful and functional way based on their identified strengths and needs. So we work closely as an interdisciplinary team. We work with other physicians, physical therapists, occupational therapists, teachers, depending on which setting we're in. And we really work closely to help formulate an effective treatment plan to really focus on those communication needs of the individual. So we really do it all.
Well, first of all, let me say this before we can move on. I'm biased. My son, Robbie, who will be 22 in September, is a former student, patient, whatever you want to call him, of Kennedy Krieger's speech pathologist, speech-language pathology program. So I know firsthand how it works. Robbie went from barely communicating to you to now sometimes you're like, shh, because he talks all the time, and you've met Robbie before. So trust me, I have 110% confidence in you all in doing what you do. You weren't there at the time, but thank you very much from a parent who was a part of that program for all that you do.
Of course. Thank you for saying that.
What are some of the early signs of autism and language?
Yeah, so speech and language delays tend to be the earliest developmental concern for parents. I'm always getting asked this question. So as a result, speech-language pathologists is often a key part when diagnosing autism. So there will always be challenges with communication, social skills, and behaviors. So regarding communication, this really includes understanding information, talking, reading, and writing. So a person with autism may have challenges with following directions or following routines like brushing their teeth or something very simple like that. As a child, we also look at, if they're talking very little or delayed. So there's always a question of, is it a delay? Is it autism? So we look really closely at that. And we also look at not just, are they speaking words, but how are their social skills? So we look at, say we look at them during play therapy. Are they sharing toys? Are they engaged in the activity that we present to them? Are they showing a social smile? Are they responding when others say their name? Are they wanting to take turns? And are they just able to make friends and keep friends? And just understanding and showing that perspective taking of understanding when people like something or don't like something and how they respond to that. So really look at those behaviors, help us really identify delays versus autism. And then some other behaviors we look at is if those individuals, instead of showing communicative intent, so instead of reaching for something, they show a problem behavior, and maybe they'll start crying or laughing or screaming. So something that you wouldn't typically expect. We also look at if the individual likes only specific types of food based on texture. So we know individuals with autism usually also have a sensory processing disorder. So we really look at all of those details to help us see if further assessment is warranted.
Now, what's the age range of your students or patients? What's the age range?
So currently I work with high school age, so 13 to 21. but speech language pathologists can work from infancy to adulthood. You know, there's
Now,
always a need.
do you actually get people on the spectrum who are actually nonverbal?
Yes. So primarily my caseload right now consists of a lot of individuals that are nonverbal or have some language.
Right.
So we typically use AAC. It's also called augmentative alternative communication. So this really helps supplement that or aid in their communication. We also use sign language or modified signs depending on, you know, what the student is physically able to do. But yeah, so a lot of my caseload, I have students who are nonverbal, so I introduce them to a high-tech device or a tablet where they're able to click pictures or words to develop sentences. Or maybe some individuals can only say 1 to 2 words. The device helps them expand their sentence length and complexity. So it's really nice when the device helps almost guess the next word, and it helps them produce expanded sentences and really helps them increase their vocabulary and really get more detailed in what they want to say if they didn't have that device to supplement that.
Penelope, you mentioned AAC. Explain that to us. What exactly is AAC?
Yeah, so it stands for Augmentative Alternative Communication. And we use AAC all the time. It really just means the way that we share our ideas and feelings without talking. So we can use forms of AAC through body language, facial expressions, gestures, sign language, or through that high-tech tablet that I was discussing. So there are 2 types of AAC. There's unaided systems and aided systems. So unaided systems, you only need your body. You only need your hands for gestures, your facial expression, your body language. And then aided systems is where we really come into play, or specifically for me, for my nonverbal students. So this is where you have a high-tech or a low-tech version. So those high-tech versions are a tablet or typically an iPad. Or a low-tech aided system can be, you know, a printed out picture of icons or PECs, where the individual will just point to the pictures to communicate rather than clicking on a tablet that actually speaks for them. And then what's great about AAC is that we really look at the whole person before identifying which AAC program is best for the individual, because as we know, they could have some physical limitations. So there's various access methods that we could look into. So if we're working with someone with cerebral palsy and they have that paralysis in their arm, we can look at eye gaze, where they can just look at the tablet and blink to select words and pictures to communicate. There's also different ways to control the mouse. So say they can't reach to click, we can find a different mouse where they can select and spell out words or choose pictures, whatever it may be. And SLPs really help with that assessment. So they really look at how you can understand and express language to help identify the best AAC system for you. So that's where our role really plays a major part.
You know, Penelope, one of the things we've learned about individuals on the spectrum, there's so many different solutions because there's so many variations of being on the spectrum. What's the best treatment for an individual with autism?
Yeah, so a speech treatment program really begins with a formal evaluation. So we need to assess the person's communication strengths and challenges. So from that evaluation, whatever results we get, an SLP will identify individual goals and objectives for therapy. So then we look at those goals and we incorporate evidence-based practice and treatment methods to directly target those skills. So there are so many intervention strategies that we use. For our kids with autism, it's really common that we incorporate a lot of social communication treatments. So a few strategies that I like to use is I like to have my social skills groups. So what I like to do is include social scripts. So let's say we're ordering at a restaurant. Let's create a social script. Let's do some role playing. Let's create the scenario and let's practice what that would look like. And what's nice about Kennedy Krieger is that we have industries and we have work-based learning. So these students are able to go out into the community and practice what we do in therapy in real life settings. So they'll take those social scripts and they'll practice it outside. And the more that they become more independent, the more we can pull away those supports and those visual scripts until they can generalize those skills and be more independent. We also like using social stories. That's another great treatment method that most individuals with autism have probably been exposed to at some point. So these are used to help teach expected behaviors within a difficult situation. So we know a lot of our individuals don't like change. So let's create a story that they're involved in, that they're motivated by, and identify how to produce an effective response in that situation. So we do a lot of social communication treatment. But overall, the best practice, I feel like, really includes identifying all the other needs an individual may have. An individual with autism is very complex. It's not just do they talk or not. How do we treat that therapy? We really need to think about their behavioral issues or their sensory needs. So if you're planning a treatment and you're playing a video, if that sound does not blend well with that individual and they have a behavior, we have to know how, we have to know what textures they like, what sounds they like, what visuals they like. We have to know their behaviors. Can we incorporate a reward system or a token board? So there's a lot of other factors that we need to think about when planning therapy. And I feel like just knowing the whole person is the best way to really treat an individual with autism.
Penelope, if someone is receiving treatment from an SLP like yourself, is it a program to where you eventually graduate, or do you stay in that program as long as you stay in?
Yeah, that's a good question. So there's a variety of programs. I've worked with individuals early adulthood to late adulthood within the Loyola Clinical Centers when I was a graduate student. So, there's always a need for communication. So it's not just school-based. Once they leave school, they find new needs for communication within a work setting or within building relationships. So there's definitely programs that really support social aspects depending on whatever age you're in. Right now I'm in the high school, so obviously they do graduate. But there are so many transition programs that help with those social skills and help with building resumes or, maintaining a job, because, there are new challenges that arise the older that we get. So there's always an opportunity, and there are SLP programs that can help target those needs at whatever age.
Now, it's a team, it's not just the people, the team is not just the people who work there. The team is not just the individual's family. So if you're a parent of someone with autism, what questions should you ask their SLP?
Yeah, so I just feel like that's the most important thing to think about. You really just need to be involved. You have to play an active role in that program. So good questions to ask is, what is the treatment plan? What is the SLP targeting? So after that SLP assesses your child, they're going to identify goals and objectives. So feel the need to voice yourself and say if you agree with those goals and objectives or not, if they make sense for your child, if they're applicable outside of therapy, because that's the main point, right? Not the structured setting. It's, can these be carried over into their natural setting at home or in the community? So really voicing yourself and saying if you think it's appropriate or not. And then just asking to come and observe sessions, see how we're implementing these interventions and how we're targeting these skills. Ask for copies of the visual supports that we provide, the visual schedules, the social scripts. Having all of the materials that we use in therapy at home helps that student generalize and carry over what they learn in our structured setting. And then I really think it's important, I like to use this with my parents, is asking for a communication log. So with this, I write down the activity that I worked on, the goals and objectives that I targeted, and a follow-up activity that they can do at home. So again, this really plays into the generalizing and the carrying over. Parent training is such a big part of what we do, and it's really the main purpose, because what we do in therapy isn't as realistic. We need to carry over all these things at home in a natural setting for them to stick and for our students to be as independent as they can.
Penelope Kaikis, speech language pathologist at Kennedy Krieger Institute. Thank you so very much for your time today. Very educational. Thank you.
Thank you. Of course. Thanks for having me.